What about frequency? You mentioned in the case study, Dr. Miller, that in that case, every patient was assessed every time. And then also comment on, we oftentimes ask our patients to consider themselves. Give us a report back of how you are doing. But we know that from a feedback-informed treatment and outcome rating scales and all, that those are tools that where the patient actually is measuring our ability to be an effective clinician for them. Can you talk about those 2 points?
So how often to administer an outcome tool? And in our work, we administer 2. We have an alliance measure or a relationship measure. And the reason we use that is because it predicts engagement levels on the client, and it's a solid predictor of eventual effectiveness. And then the other one we measure is well-being. The particular scales are the SRS and the ORS, which, as I say, are available in 30 different languages from my website. When people ask me about how often to administer it, here's what I say. Clients are always thinking about, did it help me? So when you meet with them, that is a perfect opportunity to get a final check-in with them. At the beginning of the visit, I'm saying, did what we do last time make a difference to this time? Because if not, that gives me an opportunity to change. So that's the crucial logic. I did an intervention last time. There's been time in between visits. Did it help? Because that gives me an opportunity, as I say, to alter what I'm doing. At the end of the visit, I'm giving in a relationship scale, which is a formal way of simply asking, did we work on what you wanted? Did you feel understood? And is there anything more we didn't discuss? It adds completeness to the visit. It provides a final check, because if the person leaves your office and feels like they didn't get what they wanted, they're not going to be unhappy, or they're not going to be happy. And there's a chance of one of 2 things. They don't ever come back. Or secondly, they call back relatively quickly to schedule another appointment, thereby creating a bottleneck at the in your practice. So I would say every time you deliver a service. And then I would also add that depending on the particular person, it can be nice to check in on a random basis in between visits to see how people are doing. We found, for example, that top performing therapists, hold on to your chair, are much more likely to have clinician initiated unplanned contact between visits than average therapists. We ask them why, and they say, I don't know, I had a gut feeling that maybe I should check in with them about things. When was the last time your healthcare professional called you between visits? What would you think if they did? A, oh, there's something wrong with my insurance forms. B, the credit card number was transposed. 3, I've got cancer and I'm dying. That's how rare it is that our healthcare professionals don't attend to our healthcare between office visits. By the way, office visit is not healthcare. That's where the healthcare is done at that moment, but the healthcare is an ongoing connection with the provider. So sometimes people will come on break after I've said this last piece about calling people, and they'll say, oh, what, am I supposed to call all my patients between visits? And I said, you're thinking far too literally here. The issue is, what would constitute good healthcare in your client's eyes? And my guess is, or at least I'll say I do. I leave the office some days, I've seen 6 people, and one of them is on my mind. Mm-hmm. And I'm replaying the visit in my head. I wonder about this, and I think about that. And then my sleep is disrupted a bit that night. And then the next morning I'm thinking, why don't I pick up the phone and call this person? And I was trained that in the mental health field, this is a boundary violation. You want very strict boundaries, and people will call you all the time if you do that. In fact, their outcomes are better. Mm-hmm. You're simply attending to people.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.